Hey Google, turn off the music. You guys, good morning. Happy Tuesday. Welcome to, I believe we're in week 13. So that means we only have like 3 more weeks to go. If you're in school, y'all, how many weeks do y'all have? When do your exams start? Let me know in the comments. I did not get a lot of sleep last night, so I'm super tired. I was planning on getting up early so I can, 1, do my lashes, which I did, and 2, stop at McDonald's and get a little breakfast or whatever, because I do not want any of the food I have in the house. I'm sick of eating the same stuff. But I was so tired, y'all. I just kept pressing snooze on my alarm. So I woke up at my regular time. But honestly, I might just stop and go anyways and be a little bit late, because I really don't have nothing in the house that I would want to eat. But I got this new set. It's from Pretty Little Thing, obviously. I ordered another set. It's a black set. I'm gonna show y'all it in a minute, but it don't fit. So I don't know if I should return it or if I should give it away or if I should resell it. I don't know what I'm finna end up doing with it. But I looked on the website. I don't think I seen like a bigger size in the pants, but I didn't see a bigger size for the shirt, and I need a bigger size in both. The shirt, I need a US 8 or a 10. The pants, I need probably a 10. So their sizing is so freaking weird, but I mean, I have been gaining weight, but I don't feel like I've been gaining that much weight to the point I wear a 10 now. Like, I'm still a 6. I might be growing into an 8. But let me show y'all it real quick, and then we're gonna get ready to go. Okay, these are the pants. They flare, they have a slit. And these are in a 6, but honestly, I feel like they fit like a freaking 2 or something. And it's, I'm not showing you around. Okay. But yeah, they're at a 6, but I feel like they're super tight and they fit like a freaking 2 or something. And the other, I have a set like this, and that one was too tight too. But I thought I was sizing up, but I guess not. Anyways, let me know down below what y'all think. I'm finna get ready to go. This is not the line. Yeah, y'all gonna make me especially late. Y'all, this McDonald's be moving, so that's why I chose it, because they be, you know, flying through the people, but it look like they have an off day today. So, yeah. That's why you don't stop me just like you're not supposed to be. Never mind, you guys. We're starting to move. We're gonna be up next. It's a truck right here. Maybe he was getting a delivery. That's something.
Hi, is your mobile app?
Yep. My code was JW13.
Okay, Michaela?
Yep.
You can go around. Thank you.
Now, does anybody know what this is? Because why it's like plugged into the building. I wonder what that's about. Let's see if I can drive and not hit this truck. Oh, I can drive. Never mind, you guys. It took about 7 minutes to get through the line. I got my egg McMuffin, 2 hash browns, and a smoothie. It's not focused. But yeah, it's 8:56, so we're on the way to class now. placement of these cones is kind of odd, so I'm guessing somebody who live here put them cones up so people don't park in their spot. We walking in.
You're going to see infants moving through their noses. In the mouth and the throat, infants' tongues are proportionately like larger than an adult's tongue is. So the way your tongue fits in your mouth, kind of like in between like your teeth and all that, an infant's tongue is just like still one tongue, but it's not separation. Great. So definitely know these differences. I'll just be honest, there's questions on the exam about differences between a child and an adult anyway. When you are doing your respiratory assessment, you know, divided between history taking and factors of so for history taking, be sure to review any past medical history, especially noise really high at the rib cage or between the ribs, sometimes above. So here's this little guy so right under his sternum, you can kind of see along the computer apparently. Along with the claustral region, you can see just indentation. I call these moderate indentations. He's also having nasal flare. You can kind of see it. Basically, they're trying to exhale and they're struggling, and so it's going to sound.
Children who are struggling to breathe often make a characteristic grunting sound when they breathe out.
So don't say, oh, they're finally calm. They can take a nap. I can go chart. No, you should call the provider. If you're the stats can drop pretty fast. And so
I should have brought fork then. Why did I bring?
I did.
Why did I bring?
one of the scariest situations I ever saw working in the NICU was a premature baby who ended up having to get a trach, and then she was like 6 months old at this time, and then somehow, well, I know how, her grandmother gave her RSV, and she got so sick that she was like needing to be on a ventilator, and having to go to what's called an ventilator. Essentially a machine that shakes the chest so rapidly that it allows for gas exchange to happen. It just sounds like thud, 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 thud. There's no like breathing. And I wasn't sure if she was gonna make it through the night. We had to fully sedate her and paralyze her. We used that method. And she was really sick for a while after, so she was close to going home and she had to stay for quite a bit. But it's really, really bad. So, a little bit more on the scientific completing his assessment. So, here's some of the assessment information. Sit for a second reading through these and identify for yourself, like, what things are of concern to you, or what would need further follow-up.
Look at it. It's not like an odd assortment of cones. Somebody definitely just holding the spot. Hey guys, so
done with class. We got out at 11:40, so we got out basically on time. Hey you guys, so I'm out of class. We got out at 11:40, so basically right on time, 10 minutes early. She had an activity in the middle, towards the end of the lecture before it was done. And then she lectured her last few slides, and then everybody packed up again to leave. And she was like, wait, I have something else. So then we did some practice questions, some more practice questions at the end. But, yeah. Oh, I wanted to ask you guys' opinion. One, they were like, why would you get an Egg McMuffin over McGriddle? Like, I like McGriddles, like, they're good. I used to be really obsessed with them when I was a kid, but I'm not as obsessed anymore because, I don't know, they're a little bit too sweet. Two, so do y'all like an Egg McMuffin or McGriddle? And two, they were like, did you put grape jelly on that? Like, that is so weird. I'm like, what am I supposed to put on it? They're like, you're supposed to eat it dry or put butter on it. Like, what do y'all, I should have asked them, what do y'all use jelly for? Do y'all strictly use jelly for a peanut butter and jelly sandwich? Like, what else do you use jelly for? Because I feel like it's go perfect on a breakfast sandwich. Let me know down below what y'all think. Does jelly go on a breakfast sandwich? I feel like congested a little bit. But, yeah, that's basically it for today. I'll see you guys on Thursday. Good morning, guys. Happy Thursday. So so for my scholarship, we got one of our requirements is just to volunteer, right? And I gotta do that by next week, y'all. And I feel like when I was in high school or middle school and I had to volunteer for something, like, I would find events to volunteer for with ease, but I've been on Google and I can only find stuff that's like they want you to apply kind of thing, like for a job. Like they want you to interview and do a background check. Like, where is the just you volunteer for one day and that's it? Like, they looking for low-key for free employees. Like, but anyways, so hopefully I end up finding something. If not, I'm gonna have to leave class early and be late to work to volunteer for this one event. But I don't know, I'm gonna see what I can find. And y'all, I'm so busy with work and school, but I'm gonna see if I can find something for Saturday or for Monday. That would be perfect. I would have just volunteered at this one food pantry I volunteered at before, but I think they're gonna be closed this weekend because of Easter. So yeah, that's kind of why y'all closed for Easter. That's one thing I don't understand, when everything be closed for like religious holidays. That be framing low key. And the event is on Saturday. The event, they be feeding people on Saturdays. They don't feed people on Sundays. So I could see if it was, they did things on Sunday, but they do it on Saturday. But yeah, hopefully, I'm gonna just see what I can figure out. But we got Patho Pharm and Health and Illness today, our public health class. Yeah, so I'm not running late, but I am a little bit behind because I was getting out of bed slow this morning. So I'm finna hurry up, make my lunch, and get ready to go. Another freaking dog. Why do I keep seeing stray dogs? I keep seeing stray animals. Like, what is that about? And that's a cute little dog, y'all. I want to pick up all the animals. I might as well start a damn animal shelter at this point. That's my real calling. Yeah, I'm running behind. Like, time just started to pass so fast. Like, I thought I was just running 5 minutes behind. Before I know it, I'm running 10 minutes behind. So I'm gonna be a little bit late today. But I'm gonna see y'all when I that late, but just a little bit.
Watching for them to come and get my wife for surgery. I thought maybe they'd get here early. We just want to get this over with.
More nervous than their wife. C, he'll be better after they come get you. D, Heather stands in silence while placing her hand on Mrs. Travis's shoulder, because that's communication, just nonverbal. E, is there anyone else coming to see you? Or F, you should ask them to step out.
It has been 2 years since COVID-19 brought the world to a standstill. Life changed, but among the most severely impacted are the healthcare workers. The patients has led to burnout, PTSD, and other mental health concerns for many healthcare workers. Biggest stressor.
I am trying to locate my phone to dial up their family members so they can see them for the last time. That is traumatizing enough.
We've definitely felt it in the children's hospitals.
Can it cause constipation? Are you gonna have an increased sexual drive while taking this medication? No. Okay, you will notice a maximum effect within about 10 days, so a week and a half.
Watch in a couple of weeks. I'm gonna be skinny.
Oh my gosh.
You're moving around, collecting eggs. I don't even know if you're into
I don't understand this question. Contributing sexual factors.
1955. And very important, you know. What did you say your name was again?
My name's Cody. Can you tell me what brought you here today?
My daughter in the car.
Ms. Watson, can you tell me exactly what medication it is that you stopped taking?
Lithium. I don't like the way it makes me feel. All I do is sleep that way.
Ms. Watson, you see...
This client is exhibiting various manifestations.
I see your provider is Dr. Price.
Dr. Price is a jewel! Dr. Price is right, and he is right. He says I'm all right. He knows I'm the one who lied. I don't need to be here. You need to save the best for someone who's really sick and needier.
She's overly excited, she has euphoria, flirty, sexual activity, grandiose, cancer. Flight of idea, that's one. She does have word association. So that's, I see that on here. That's gonna be a big one. When we think about her basic needs, we have to get her to sleep. They have really great examples of some of this behavior. They pretend they're like catatonic. They won't move, they won't react. They just sit. I've seen that one too. They just remain in place. And sometimes they'll fall on the floor, and then all of a sudden they'll fall on the floor and pretend like they're having a seizure. So it can be very difficult to treat the patients because their mind and body has this disassociation, and you're trying to cement them back into reality. So it can be difficult to redirect them. So milieu therapy, there it is again. It's all about having a good environment that promotes their
No sir, 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 no sir. No make back, but I ain't got a chauffeur. I'm in it for the bread, put you in a toaster. Hey, yes sir. Got a little older, was a young flexer. You know that it's a go, cause my jacket checker. Pop one pill, but it's a double decker. Yes sir. I ain't talking schools, I'm waiting on a transfer. Send a pussy boy to meet my ancestors. Put up on the block, it's hot flaming Chester. Yes sir. I just flew a bitch in from Manchester. They took me to jail, I should've smacked the rester. I'm about to come flexing like Sylvester. No sir.
Hey you guys, so I'm out of class. I'm still kind of upset that I didn't get to play the booklet game. I stopped to record for y'all to show y'all the little egg hunt thing we were gonna do, and then I tried to go back to it and it kicked me out the game, and I tried to like re-log in and it said the game was full. so I wasn't able to play. But I guess it was just like you go and grab eggs and you answer nursing questions or whatever. Seemed pretty fun. But yeah, I'm on the way to the gym. I'm not gonna do too much today because I barely ate anything. I've only had some grapes and I drank a little bit of the protein shake, so yeah, I'm kind of working out on an empty stomach. Yeah, I'll see y'all at the gym, and it's so freaking cold. I thought it was gonna be warmer today. It's like flowers growing. I think they are some type of flower. I got my new balances on that I just bought. They're pretty comfortable, but not as comfortable as people made it out to be.
Poppin' right about the blue type shit. Put the double O in the mood. Serotonin, that's a cool type mix. Oxycontin mixing with the loose. Used to learn I'm feeling like a zoo type mix. Shot, stripping, taking shrooms. Eating all the perks on some food type shit. Shot to make it work 9 to 5 type shit. Eating all the perks on some food type shit. Eating all the perks on some food type shit. All the homies crashing on some food type. Flooding up the bodies like a pool type. All the homies crashing on some food type shit. All the homies crashing on some food type. Eating all the perks on some food type shit. Kick slow flow, jitsu type shit. Red out of my dread like some on boom type shit. Cook a nigga up like food type shit. Push it up for my dogs, cookie dough type shit. She gripping out of my balls, I got a move type shit. Thomas they cover my flaws, I ain't had to pay a new type of shit. Come around joint with the best, I look like a new type shit. All of my
You can put that on here.
It just sticks.
Yeah, that's the sticky part right there. Yeah.
Try not to drop the shit. So I have some Jolly Ranchers. As I was leaving the gym, I ran into a fellow nursing student. They had this little setup for, I think it was some type of blood donation for leukemia. So I did like a mouth swab or whatever to see if I'm a match. She's like, I have an excuse for you to be late to public health. So I couldn't say no. I want this though.
And we just want to make sure that everybody has the resources when they do today. So, thank you for that. If you, at any point in time, if anybody also needs to step away from the presentation, we definitely encourage that, not just because you may have personal feelings, but sometimes just hearing about these things can be stressing. So, definitely do that. Primarily, many of the patients have experienced sexual assault. But we also see patients that have experienced inter-partner violence or domestic violence within their relationships. A large population of patients that I experience working with at the bedside were victims of human trafficking. And when we think about human trafficking, I think there is not the knowledge out there publicly that.
Hey guys, it's 3:27. We just got out of our public health class. I think I showed you guys a clip of the presentation. There was a guest speaker. She was talking about forensic nursing. So they mostly do like rape kits and stuff of that nature, or they help with like autopsies and all types of things. And then we started our presentation, so we're starting to do our final presentations. My group, they chose the last day of class. I don't know. I do not want to go the last day. Like, I would rather rather just get it over with. So I'd rather do like the middle. I don't want to be first, but I definitely don't want to be last. Like, I think being last is terrible. Because I just want to come to class and relax and vibe and watch everybody else go. But we're going the last week nonetheless. Yeah. I was debating what I want to eat tonight. I was thinking about getting Noodles and Company. They have some $5 rigatoni, penny rosa deal or whatever. Well, rigatoni rosa deal, because they changed the noodles. But I will get chicken with that too, so, because I can't not have chicken. But I don't know, like, nothing sounds good. Y'all ever just get in the mood where nothing sounds good? So I'm just gonna go home because I don't know what I want, but I am gonna be mad because there's so many food options right here. I like to just pick up stuff, go home, and stay home. You know, stay parked for the rest of the day. But oh, and one of the girls, I don't know, she said something about espresso martinis or something she was making. I don't know. I feel like coffee and liquor don't go together, but whatever. It sounds like a good time, so I might slide through there. But yeah, I'm gonna see y'all tomorrow for clinicals. I hate driving through here when like the high school gets out. So much traffic, so many people coming to get their kids and all the school buses. But yeah, I'll see y'all tomorrow for clinicals. I gotta ride on. Hey you guys, good morning. Happy Friday. So today I have my clinical. I have a ride along today. And I woke up this morning, it's storming. It's thundering real bad outside. So our teacher told us to wait a minute to go to clinical. So yeah, but I think the storm, no, it's still raining kind of hard. But I don't know, it seemed like it's slowing down, but maybe not. But yeah, I hope we don't get a lot of calls, because like I'm gonna need to bring my umbrella with me so I don't get soaking wet. But yeah, I'm finna get ready to head out in a minute. I don't know where the hell I'm going. It looks so crazy. Guys, I think I found it, so I'm finna go in. It's so freaking dark and rainy and scary. But yeah, hopefully we don't get a whole lot of calls because I do not want to get wet. But alright. It's 12 o'clock. Nobody's cooking. It's giving they not eating. Because usually they have lunch ready by 12. But maybe they do it different over here. But I'm gonna start eating because I'm hungry. So I'm sitting in the kitchen dining area. I'm watching how to be a man. How to keep a man. What is this movie called? Y'all know what I'm talking about. I can't think of the name right now. They got BT on there. I think I've shown y'all that we might want to call. But I'll tell y'all about it later. Which door do we go out? Hey guys, so it's 1:51. I'm heading out a little early. Our teacher always tells us to leave at like 2. But they kind of was like, you know, if we get another call, like, you will be late, so you're welcome to go. So they told me that at like 1:40 something, but I just stayed a few minutes and then packed my stuff up. But today, so I went on the med unit. I rode with them today. We had one call. It was a fall, so when I heard that over the radio, we were kind of assuming that it was going to be like an elderly person, and you know, they fell, because that happens a lot with that population. But it actually ended up being a possible stroke. Her eyes were deviated to the left. Her right side, she couldn't move it. Her face was drooping. Now when we came in there, she was on the floor, so they knew she was unresponsive, and they knew that something was wrong and they would need to take her, but they didn't know about the stroke symptoms until they got her up in a stretcher and got like a real good look at her. So we rolled to the hospital. They gave report, got her transferred. There was a lot of people in the room, and they got right to it, giving her cares or whatever. And then we went to the EMT room, and he finished typing up his report or charting or whatever, and I had a soda. They always have like snacks and drinks and stuff in there. So yeah, that was my first time actually going inside of that hospital. It seemed pretty nice, but they originally thought it was like she had a seizure or something, and they were gonna take her to a different hospital. But once they figured out that she's showing these stroke symptoms, they took her to another hospital, because different hospitals have different specialties, and some of them don't take stroke victims or stroke patients. A bird just pooped on my freaking car. That's my first time ever having a bird poop on my freaking car while I'm in the car. At least I'm not out the car. At least it didn't poop on me. But I thought that was some water or something. So after that call, we drove back to the station. We were sitting for a minute, and then they said they have to go out and do some type of errand. So we got in the med unit, the truck, the engine, you know, they got in their truck or whatever. So we drove to this location they had to have their picture taken. It was funny because they didn't want their picture taken. They're like, oh my god, this is a waste of time. But they had to go under this bridge, and the engine and the med unit, they kind of met up like this so that they can like block off traffic and take picture under this bridge thing. Something about a anniversary or something. But yeah, then after that what do we do? Oh, as we were driving back, we seen an elderly woman in the street, and she kind of was just like standing like a robot, kind of, for lack of a better word. And he was like, oh well, maybe she's just waiting till this car turns. Then the car turns in front of her, and she's still standing there, and the light changes, you know, green for us to go, but she's still in the middle of the crosswalk. So they pulled over to talk to her, see if she needed help. She was like, don't touch me, when the guy got out the car, and she said she was fine. So we went on our way. She was holding a bottle of wine, so maybe some type of alcohol use or something along those lines. But yeah, and then we went back. We were sitting for a minute, and then I ate by myself. I usually wait for them to eat, but it was 12 something. Nobody's even in the kitchen. The engine, they were still going, so I'm like, I'm gonna just eat. I'm not even gonna wait for y'all. So I ate, and then 12:30ish, they started getting their food ready. They had buffalo chicken wraps, salad, and tater tots. They always have tater tots. That's something we talk about in post-conference, how they always are eating tater tots. But yeah, so they were watching a video of another somebody they work with or whatever. He has some like YouTube channel or something, and he's trying to invent some type of product. But as they're watching the video, I just had a feeling that the alarm was gonna go off, and then it goes off. But it's one of the like continuous alarms, so I'm guessing that means there's like a serious emergency and they need to hurry up, run, and get into the truck. But for that one, they didn't need the med unit, so we stayed behind. But just seeing them get up so fast and run, like, it was crazy. And then they came back shortly after, so maybe it was a false alarm or somebody else responded first, I don't know. And then after that, they came back. They got another call for the engine. They haven't returned yet, so I'm guessing it's something actually going on. but nothing else for us in the med unit. So, oh, they're actually pulling up right now. But yeah, so that's basically it. I'm finna pull off and go to post-conference, and I might come back and say a few more words, but yeah. And guys, oh, and what I was trying to say earlier, I was watching the movie. I was watching Think Like a Man. I don't know why I said How to Be a Man, but I meant to say Think Like a Man. But it's really warm out. My car says it's 69 degrees. But yeah, it feels really nice, so I don't need this big coat anymore. But yeah, I'm gonna check in with y'all post-conference if my classmates say something interesting or whatever, or to just end the vlog. Hey guys, so I'm back home. As y'all can see, one of my colleagues had an interesting day. So one of the ride-alongs or calls she got was for a young man. He got shot. They went to a hardware store at first because that was the location they were given, and nobody was there. Nothing was going on. And the police, they were like, oh, this is a prank call, like we need to leave. And I guess somebody came and said, oh, try the other business next door, some vape shop. She said it's a vape / restaurant. I don't know, but I guess they went there, and I don't know if he was in the building still. I think he ran down the street or something, but eventually they found him. He said he's not from here. He claims to be not from here, and he don't know who shot him and whatever. But yeah, the other call she got, this woman was in labor. She was preparing to give birth to her 8th kid. 1, 2, 3, 4, 5, 6, 7, 8. That's so crazy to me. I think my max amount of kids, 3. Maybe even 2. Honestly, possibly 0. Like, I might not even have kids at all. What is your max amount of kids that you would have? Or how many kids do you currently have? Let me know if you're watching right now. But yeah, she said something else, but I can't remember. Those are the main interesting calls that they got today. And the other girl, she didn't get any calls, but they let her, she asked for a shirt, and she paid the $5 for a shirt. We're so jealous of her. Like, I want a shirt. I would love a Milwaukee Fire Department shirt. And this was our last ride-along, so no more opportunities for that, but we're almost done with the semester. Our last clinical, I think, is going to be May 2nd, so clinical is going to end a little bit before our other classes end. But yeah, anyways, thank you guys so much for watching. Don't forget to like, comment, subscribe. I'll see you guys in the next video. Bye.